Hello.
Yeah, yeah, yeah. No, sorry, I couldn't see you. That's why. So I'll just give a brief introduction of her. Dr. Henal Shah. She's a professor, Department of Psychiatry from Nair Hospital, Mumbai. She is the recipient of Savitribai Phule Award for Excellence in Work and Contribution to Health Services of Municipal Corporation of Greater Mumbai. She has a master's in psychiatry from Chem Hospital, graduated with a master's in health professional education from University of Maastricht, Netherlands, has received international fellowship for medical education awarded by Foundation for Advancement in International Medical Education and Research, Philadelphia. Besides medical education, her area of interest is in the field of child and adolescent psychiatry. So now I request Dr. Henal Shah to give a presentation or talk and help us uh, in in devising a better communication strategy and address the problems associated with the myths and reality and also the stigma associated with the COVID-19 patients. Please, ma'am. Again, I
Thank
request
you.
others to mute your mic.
Just give me a moment to get this technology going.
Yeah, yes.
Is it visible, my slides?
Yes, they are
Yes, ma'am,
visible,
it's
ma'am.
All right. First of all, thank you for having me here. Um, and thank you for all the good wishes that everyone has showered and for this song that was played. It is very touching. You know, doctors don't want to be on a pedestal, nor are they on a pedestal. But when people shower such gratitude, it's very heartwarming and makes us reaffirms our need to be allowed over here. Um, so coming back to 1 second, I can't see my own slides. You know, that's why I'm slightly worried about whether my slides are being seen. But even then, um, I was supposed to talk and begin with myths. Um, I think the doctor before me Dr. Zawar has really covered the myths very well, so I won't really get into it as much as I would have liked to talk about the myths. Um, I'm yet trying. Give me a moment, please, because for some reason this is not coming on. My slides are not visible to me, so I'm not sure whether they're going ahead.
Ma'am, before I'll just try to give an information. As I said initially, those who have any questions to ask your to clear your doubts and about the myths or any other COVID related questions, may please post your questions in the chat session. You can see the chat session towards the left side corner. Towards the end of the webinar, I shall read the questions and the doctors will be answering it. Yeah, thank you.
All right. So, Dr. Zawar really talked about these myths. So, I'm not going to really talk about most of them. Maybe I'll just mention a few. Is that the common myths that are there that are besides the ones that he mentioned is about, you know, whether you can exercise and wear a mask. And usually that is said, don't wear a mask because you need more oxygen and you're probably going to sweat, and that's going to make the mask wet. And a wet mask cannot protect you. So the thing that you can do when you're exercising is that you keep your social distancing and exercise in places. So do maybe solo exercises if possible. Go for a jog or a run or a cycle. So that is one more thing that is important. And will a mask prevent 100%? Of course not. Nothing is 100%, but it decreases the chances. And especially when everyone is wearing the mask, so the person who's transmitting or receiving the disease, it breaks the cycle and therefore it is useful. Um,
Ma'am,
uh,
sorry to ma'am, one
yeah.
second. Can you please click the open button, ma'am, so that the PPT will be visible when full screen will be visible to everyone. You just click the open button.
Has it come?
We aren't able to see.
Can you see it?
No, ma'am. We are not able to see actually.
All right, so we'll go without it.
Yes, ma'am. Yeah. Yeah, yeah,
That's okay.
please. Sorry.
I mean, we can always continue without it. So if it doesn't work, it doesn't. Because I have opened it, but I don't think it's sharing somehow. So,
Yeah.
nevertheless, so the other things that I would like to talk about is that, the important thing is that the fear. People are very worried that if they get it, they're going to always transmit it to other people, and that uh, they're worried about their children and the older age group. While the older age group is definitely more vulnerable, children also can get COVID-19, but less likely and less severe. The other thing that people are really worried about is that there is no treatment. Well, there are many diseases for which we don't have treatment, but we yet manage to support people and get them through that. So, the whole fear that really generated is that there is no treatment and doctors can't do anything. So, if you've got it, that's really the end of you, is something that has to be dispelled, and which I think the people are taking pains to do. So what are the things that we are worried about? When we talk about media, of course, we have the traditional media, but along with the traditional media, we have the modern day social media and all its derivatives that are there. And in these derivatives, we sometimes very often have a lot of misinformation. I mean, we can talk of virology and virality. Not only did the virus itself spread very rapidly, but so also did the information and misinformation about the outbreak and thus the panic that it created amongst the public. The social media panic traveled faster than the disease could spread. And misinformation on the virus might be one of the most contagious things really about it right now. So one has to be really careful and be aware that this is happening. Means as Dr. Zanwar has talked about that whether this is is a bioterrorism, whether there are fake cures that are available on Amazon, whether the market for sanitizers and face masks who do not even have the quality assurance are burgeoning in the market and causing so much panic. So this is the misinformation that is really going around, and associated with it, I think besides the misinformation is the stigma. We started off without, when the name was not there, it was called the Wuhan virus. And it stoked a lot of fear and xenophobia. People were worried about, where it originated, whether it was bats, whether it was having soups, whether it was having non-veg. And many things happened because of maybe the way we spread the information, and maybe more so in the non-traditional media and the language of reporting. So what happens is when they started talking about say area is sealed or the building is sealed, and the picture would come of that sealed area and that notice. So one felt that one had done a horrible thing. You are in the newspaper showing how bad you have been, where actually you had no role in it. I mean, you don't want to invite the virus. It just happened like any other disorder could have happened. So there was a lot of fear, shame, guilt that was involved. And along with it came also the fear of spreading the disease. One doesn't do it deliberately, it happens involuntary, it may happen by breach of protocols, and all this led to a lot of fear and shame and naming people and things like that. So came stigma, and even words that were used, words like super spreaders. I mean, it made one people feel horrible. So you could be a person who spread it, maybe never spread it because you were lucky, or you spread it to somebody, or you were a super spreader and spread it to many people. So words like this that were used in the media caused a lot of stigma. And this kind of stigma and fear unfortunately led to people not coming easily for treatment. So they would hesitate, even if they had a fever, they were worried to go to the doctor or even tell their friends that they had fever because you could be having COVID positive and you're going to cause worsening the disease and worsening the pandemic. and because of which people come later into the field to treatment, and when they come later, complications are more and outcomes are poorer, and therefore the spread of the disease is more. Along with that came politicization and many other issues that led into stigma. So, the role of the media, as we see it, as doctors see it, is that there is effective health communication, and health communication about the disorder, about sustainable preventive measures, and curtailing of misinformation. Public health communication to increase resources and resilience in the different age groups, and especially the vulnerable age groups and the socio-economic conditions that they are in. And we are hoping that the media will be able to provide resources to increase resilience. We are hoping that the media will improve strategies for helping individuals in dealing with social and physical distancing, give them practical information, news which can be used so that they can learn how to improve themselves and prevent the disease from spreading, look after themselves even if they're doing home quarantine. How is it to be done? Where is help available? What is it that is to be required? The use of a pulse oximeter in home quarantine, so you know when things are getting bad and when you need to get help and where you can get help. And we're looking at media to reduce stigma, prejudice, discrimination, and inequalities that are always there. While, like I said, while traditional media, non traditional media, people want to know and people talking about stigma because it's already covered, I will go on to talk about as what I have been um, uh, told by Mr. Deep and Ms. Dr. Tushar is impact of doctors. And I must thank Dr. Tushar Karmarkar, who is part of this organization of yours, who's invited me here to talk to you. And he, while is on the other hand doing duties in our hospital. So he has volunteered to come to Nair Hospital and do duties. And I'm sure he can also share later um, his stint as a volunteer in a COVID hospital, because Nair Hospital has become a COVID hospital. It has 1,043 COVID beds, and we are totally looking after COVID patients. So, how has it been for the impact for the doctors? So, I will look at it from two pieces. One is, of course, the doctors who are in the hospital, and the secondly is the doctors as a whole community. One is never prepared for the pandemic. Neither were we, the doctors, the systems, or the healthcare hospitals that were there. And therefore, we all had to make a quick jump into start preparing for the pandemic. For simple things like oxygen. In normal times, we need not need oxygen for all patients. Now, our hospital usually only admits moderate to severe patients, and most of them would require oxygen. So, our systems had to adapt so that we can supply oxygen to almost 1,043 patients. So, getting our system up to date to get oxygen. We had to have doctors who could look after clinical work of pandemic. Not everyone knows what is infectious disease. Not everyone is trained in such a manner to treat with it. But our whole working force is now looking after patients who are afflicted with COVID-19. As many people say, we are in war. But the difference, I think, when doctors are going to war is they're worried that they're taking their family to war, as the previous doctor so nicely highlighted that of course that it is an infectious disease. So you're worried that you may take it home, you may take it to your colleagues, and you may take it to other people. And because of that, there is always this constant fear that I may take it home and I may infect my mother who's 85 plus, and therefore she's a vulnerable population, or I may take it home to my father who's diabetic and hypertensive and therefore is a vulnerable person. So not only are you fighting the war, but you're worried about getting your family involved in the war. So this is another thing that is happening. The third thing I would say is uncertainty. Who can predict how this pandemic will go? We may have many models, we may have many hypotheses, but nobody can say for sure. So there is uncertainty. How long will it last? How will it unfold? What will happen next when there is mission unlock happening? These are things we really don't know. So learning to live with uncertainty and dealing with uncertainty is another thing that is affecting doctors. Even as the pandemic evolves, what medications will work? What trials should we give? This is uncertain. And of course, we are learning from each other and we are having webinars and we are having sharing of best practices to learn what works even within our context and what works in the local and the global forums. So there is uncertainty. And of course, like all people, doctors too have emotional reactions of fear, of anger, of stress, and associated with that, insomnia, sleep appetite issues. Further, many of us are posted in rota. So you work, say, maybe 8 to 2 in the night, or you're working 2 to 8 in the afternoon. So you're working in shifts. And as you work in shifts, of course, your biological rhythms change. And that itself can also cause stress within you. Again, you may be a psychiatrist, but you're working for patients with COVID. You may be a skin specialist, but you're looking after patients who require oxygenation and ventilators. So you're not working in your comfort areas or in your areas of specializations. All of us are working only for one thing at the moment, and that is COVID. And therefore, you're working out of area of your specialization and comfort area, and that itself leads to stress. Of course, the learning curve was quick, and all of us jumped onto the bandwagon, learned the best that we could, and keep learning on the way. But you know that this is not your forte. And not only do you know it's not your forte, you all miss it. People would say, oh, I'm a cardiovascular surgeon and I'm missing my surgery, or I am a eye specialist and I want to do my retinal surgeries, or I want to look after patients, even medicine people, or people who are doing infectious disease. They want to do things besides coronavirus, but we are all in this and missing our own field, and that kind of leads a little bit of a vacuum in us because we are missing what we were doing every day. uh, Important for us also to be on the cutting edge of knowledge. While the media keeps on the cutting edge of knowledge, we also need to know what is happening. There are newer guidelines coming up every day, newer information coming up, and therefore we have to be abreast. And while we are abreast, we also know that our resident doctors know that the exams for them are coming soon. They don't know when it will be, they don't know what is the format of the exam because it may change this time, but they know exams are along the way. And therefore, there is worry about when the exams will be, how the exams will be, and how will they deal with it while they're spending so much time right now dealing with COVID-19. Uh, there is also the fear that as time elapses, we shouldn't let our guard down. We have to be as vigilant in treating our patients and looking after ourselves. In the process, each doctor has to don a protective gear, take it out and dispose it in the right way, look after patients in the right way, maintain that social distances. And as you see, even for me, it's a new normal, sitting here with my mask and gloves and, the N95 and the three-ply mask that I'm supposed to wear over it. So all these new normals that we have been taught, to keep them in mind all the time, and also to maintain our optimism and belief that we are doing the right thing. When we are in the wards, and sometimes when we were in the wards, deaths happen. We know that's happened, and we know that sometimes there's nothing that we can do. Patient came too late, or for whatever reason, deaths happen. And sometimes that can be demotivating, and it can, make us really wonder what we are doing. But to maintain our optimism and maintain our belief system that we are doing the best, despite sometimes outcomes which are not in our hands, is is an important thing that is required so that we can serve better. And of course, we know society response can be garlands to stigma. People may salute us today, but also know that stigma is also there. People have vandalized doctors' places, people have abused doctors, people are worried about doctors entering the building because they may spread the disease. Just as societies have strewn flowers when the doctors have returned. Or I know that one of my residents was telling me that in their society, every family makes it a point to ring up the doctor once a week to motivate them. Different reactions that have come. Doctors have been worried. And as you know, doctors also get infected. And when they get infected and they're lying in the hospital or they're lying in our special wards that we have created for healthcare workers, they are worried because we know the information and therefore we are not always the best patients. And there is fear, there is anxiety, and there is worry what will happen next. So, those are the fears that even doctors have when they are infected. And of course, once they are better, they come back to work. And when they come back to work, before they come to work, there is weakness, tiredness. It takes time to recover. But I must say, most of our doctors who have been infected have within 10 days come back to serving the public. They've not even waited for the 14 days to come back to serve. Moment their throat was, moment their swab was negative or their symptoms disappeared, they have come back taking extra care because they have been very careful that even if there is a minimal chance, though the swab is negative, if there is a minimal chance they don't infect others by being very careful of social distancing, mask, wearing the PPE so that they are not infecting anybody but in fact serving the people. Besides this, there has been um, there has been changes in the systems of the healthcare. If you look outside, there was a time when doctors were not sure whether they had to start practice. There was conflicting messages coming, start practice, stop practice, and how to start practice. And we were fortunate that we are in a public hospital and we have a system set up. But if you were a lone general practitioner or a practitioner in private, how do you have enabled things so that you serve your community but yet look after yourself and you don't become the hotbed to transmit disorders? So there were changes in the systems that had to come, and people had to learn how to do it, how to procure enough personal protective equipments, how to use them well, and how to protect people over who come to see you, how to see that there are no queues waiting outside and there is social distancing maintained. Then also came the role of technology. Many people use technology to see patients, to give prescriptions, to even changing, even not only that, we are using technology even in our education strategies to train doctors so they are well versed in dealing with not only COVID-19 but whatever else may come out. So this has caused a lot of changes that are happening in the system and in the way we are delivering it. But we are also hoping while these system changes are temporary, maybe, we are hoping that there will be changes in the system for long term. There will be more focus on health, more, more money spent on infrastructure of health and hospitals and the medical healthcare workers so that we will be in the future better prepared to handle healthcare, not necessarily only pandemics. We hope we won't see another pandemic soon. But for whatever healthcare that our community requires, we will be better protected and better equipped to serve you all. with that, I end. I know that we have run over time, so I shall take no more time but say thank you and gratitude once again to Mr. Manish Desai, Mr. Deep, and Dr. Tushar Kamkar, who have organized and facilitated me being part of this webinar. Thank you once again.